What is heavy implantation bleeding?
Hello and welcome to this informative video about heavy implantation bleeding. In this video, we'll delve deep into this phenomenon that is often a source of concern for many women. Let's get started.
What is implantation bleeding?
Implantation bleeding is a term used to describe light bleeding that may occur in early pregnancy as the fertilized egg, or embryo, implants itself into the lining of the uterus. This generally occurs 6 to 12 days after ovulation and fertilization, and is often mistaken for a regular menstrual period, especially if it coincides with the typical timing of a menstrual cycle.
What makes implantation bleeding heavy?
Typically, implantation bleeding is light spotting, usually pink or brown in color, and it doesn't last long, usually not more than a few days. However, some women might experience what is known as heavy implantation bleeding. This is when the bleeding is more intense and might resemble a normal period. The exact reason for heavy implantation bleeding is unclear, but it's thought that factors like the location of the implanting embryo and the process of the placenta forming may contribute. It's important to note that heavy implantation bleeding isn't always cause for concern, but it is always a good idea to consult a healthcare provider if you're unsure, to rule out other potential issues like miscarriages or ectopic pregnancies.
When should I be concerned?
While heavy implantation bleeding may not always be a cause for worry, it's important to know when you should seek medical attention. If the bleeding is accompanied by severe pain, especially on one side of the abdomen, or if it's accompanied by other symptoms such as dizziness, fainting, or severe cramps, you should seek medical attention immediately. These symptoms can indicate more serious conditions such as ectopic pregnancies. And that's a wrap on our journey to understanding heavy implantation bleeding. Remember, while it's not always a cause for concern, listening to your body and consulting a healthcare provider if unsure is the best course of action. We hope you found this video helpful and informative. Stay healthy and take care.